According to head of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, COVID-19 hospitalizations are increasing among fully vaccinated individuals who have not received booster injections. Dr. Anthony Fauci said waning immunity from the initial shots is leading to a rise in severe cases among immunized Americans. He told NBC News on Tuesday, "What we're seeing now is an increase in hospitalizations among those who have been vaccinated but not boosted." Fauci did not specify during the interview by how much the rate of hospitalizations for fully vaccinated people is increasing. But he has stressed in the past that he is worried that declining efficacy of vaccines could lead to a new surge in the winter. During a press briefing on Wednesday, Dr. Rochelle Walensky, the director of the Centers for Disease Control and Prevention, reported a decline in vaccine effectiveness among the elderly and residents of long-term care facilities, many of whom were the first to be eligible to be vaccinated last winter. According to a recent research conducted by the Public Health Institute in Oakland, California, the total efficiency of the 3 COVID vaccines now available in the United States decreased from 87% in March to 48% in September. Although the Moderna jab was the most effective, the probability of infection was lowered from 89 to 58%. The effectiveness of the Pfizer vaccine decreased from 87% to 43%, while the J&J vaccine decreased from 83% to 13%. Miles Davenport, a computational immunologist at Australia's University of New South Wales in Sydney, and his team, made a bold forecast few months ago. They anticipated that persons vaccinated against COVID-19 would lose around half of the defensive antibodies every 108 days, based on published findings from vaccination trials and other data sources. As a consequence, vaccination that originally provided 90% protection against mild episodes of illness may become just 70% effective after 6 or 7 months. At the time, it seemed a little bit risky, says Davenport. However, his group's forecasts have mostly come true. Various immunological investigations have also shown a consistent reduction in antibody levels in vaccines. Follow-up of vaccination trial participants over time has showed an increasing risk of emerging illness. Healthcare data from Israel, the United Kingdom, and elsewhere indicate that COVID-19 vaccinations are losing their effectiveness in containing transmissible illness. Since it is well established that the COVID vaccine wane after some time, the question now is how often people would need to take the booster. Would it be required every 6 months? Would people have to be vaccinated every 6 months of their life? This question remains to be answered. Please leave your comments below on what you think. Also, please like or dislike the video, share, subscribe, hit the notification bell, and be notified when we post new videos. Thank you.